Skypoint's AI platform unifies your data estate to unlock the power of generative AI for immediate, accurate, and industry-specific answers across your organization. Skypoint lets you chat with your data in context. In order to enable generative AI, you first have to centralize and unify your data sources. It's important to understand the types of data that generative AI relies on. There's two main types of data that we work with mainly. First one being structured data. This is data that's organized in a predefined format and from your common systems and solutions, from your EHR, your ERP, CRM like Salesforce, or your HRIS system. So this is your HR data. With this type of structured data, you can ask questions like, what are our total overtime hours split by job role? It's well organized and follows a predefined structure. This is great for traditional data analysis methods. Unstructured data is the opposite. It's data that's not organized in a predefined way. It doesn't have a particular format. This is your text, your emails, videos, audio recordings, or anything that can't be easily categorized into traditional databases. Unstructured data is where you're going to get your best answers for your policies, your procedures, and answers on what to do next for particular scenarios. Let's take a look at some generative AI prompt examples, ranging from policies and procedures to clinical, operational, and even resident data. So the first category is unstructured data. Explain how our facility ensures compliance with state regulations. Right now, Skypoint is accessing the secure database with the query that we presented. So what we're seeing here is a comprehensive program. This is pulled from our internal documentation that we've uploaded to our secure demo lakehouse environment. So this is not a generic answer. This is actually information that is specific to, in this case, to the demo environment, but in your case, it would be your facility, providing instant answers to your staff about the policies and procedures. What about our internal policies to protect resident rights and addressing grievances? So this is a question that your staff might want to ask or have questions about. So it's using Skypoint to once again query the database with this specific question, grounding it in context. The name of our facility in this case is the Senior Living Demo. And this is outlining our robust policies that we have in place, addressing the question that we just asked about residents' rights. This is beneficial for staff and employees to be able to have instant access to these answers without having to go to HR or scour your internal systems to find this information. We take the information from your internal documents, upload it to your system, and provide that in a conversational way for all of your employees. You might want to be able to provide an email to a resident's family member about your current policies. So this is going to go ahead and draft an email outline based on the information that is documented in your systems for you to copy and paste into an email, clearly outlining all of the policies and procedures for keeping your residents safe. Clinical knowledge management is another unstructured data type that refers to all the non-standardized information that is relevant to patient or resident care, but it's not easily categorized into your traditional database. This can include doctor's notes, audio or video recordings of patient or resident interactions, even emails between healthcare providers. And the question we're going to ask is, what's our discharge criteria for someone with Alzheimer's or dementia, someone who's involved in those programs in our community? If they want to be discharged, what is the criteria? So we're providing this information to employees at their fingertips in a safe, controlled environment. So once we input that prompt, it is actually going to look into your database with the information that you've provided, which in this case, it's documentation. So we see that it used the Skypoint AI plugin to securely query and ask this question and came back with this response. This is a summary of an existing document from your organization. So instead of employees having to log in to a certain system or ask HR or email someone, They can have this information right at their fingertips, and it's accurate, grounded in context. What about challenges that the elderly residents might face in managing and self-administering their own medication? Probably a very common question that your employees might ask. So here we're seeing all of the challenges outlined specifically and how to address them. Key to knowledge management is understanding what to do and how to do it, and how to address the particular challenge. The third prompt that we're going to ask is somewhat related. What is our policy for prescription, non-prescription medications in our facility? How are we recording and monitoring the use of prescription and non-prescription medications within our specific facility? So again, this is going to query the database for any policies and documents that have outlined these specific procedures for this particular question, and it's grounded in context. It knows who you are. It is only going to look at data relevant to the question and to your documents. So here are the stringent rules that we've outlined regarding the use of medications in our particular facility. Now we're going to look at more structured data in the context of operational and financial data. So structured data are any of your core systems, EHR, ERP, CRM, or any industry-specific solution. So let's take a look at an example of one prompt. What are the overtime hours split by job role? And you can ask it to put this in descending or ascending order, and it tells you where the data is sourced from. So in this instance, it's our senior living demo. In your case, it would source the information from whatever system it's pulling from and list it specifically. Let's ask another question. I want to know the average time spent in minutes with prospects at the community level. So what's the average time spent across all of my community portfolios? So maybe I want to ask a follow-up question to that. Which community had the highest average time spent? So it's going to know based on the context of the conversation that I am referring to this question up here. So as I go through my prompts, if I get 3 or 4 questions deep, it's still going to remember the context of the conversation. So here it's facility number 3. Now let's move on to the next prompt. Which community had the highest admission in the year 2022? Sunrise Gardens Retirement? Okay, what was the number? So again, it's going to be able to discern a very vague question, what was the number, in the context of the conversation related to Sunrise Gardens Retirement. So 505 admissions. So as you can see, it's a very conversational chatbot that's giving you answers without having to log in and sift through reports. I want to know, what is my current resident count based on the type of living for all communities. So now we have a chart being populated with the total resident count by community and the type of living. So that's the current resident count. What about occupancy report by building? Your prompts don't have to be written out very clearly. It can decipher missing words, and based on the context of the conversation, can decipher what you are after from a data perspective. So let's take a look at some structured data prompts for clinical, patient, or resident data sets. So I'm going to ask some insurance information about a particular patient or resident by the name of Sheila Carter. Again, all of this information has been de-identified for demo purposes. In this case, we can look up the name of the insurance provider, the type, Medicare ID, policy number, the insured's name, patient number, as well as whether or not they are enrolled in a Medicare Advantage plan. What if we don't have a name? What if we just have a particular ID number? So I want to know the recent vital signs for a resident with this particular ID. So here's the most recent recordings and vital signs for the resident with this particular ID number. All of this is being pulled from our EHR records. So this is structured data being pulled right from your data sources. Say we have a resident or a patient that we know has some allergies, but we're not exactly sure what they are, but we want to look those up for Andrew. Let's take a look and see what we can find. So here's a list of all of Andrew's allergic reactions when it comes to medications or other things. We're going to take a look at some more structured data examples for clinical population health records. You can compare vital sign trends between different facilities. So here it's asking for more detailed information. And this is important because it's not going to hallucinate an answer and make something up. And that's important for the healthcare and clinical industry. I'm going to call out blood pressure and let's see what kind of a response we get. What's nice about this response is not only does it provide you with the answer, but it also gives you a reason why. It's calling out the fact that this might indicate a need for closer monitoring and medical intervention. Now I want to see the correlation between blood pressure, pulse, and respiration with some additional reference to explain the different values and what you can decipher from those values, as well as explaining the correlation. Let's compare body mass index distributions between our different facilities. Now analyze vital signs during periods of elevated pain to help me understand physiological responses. Analyze the oxygen levels and respiration rates over a period of time. Now let's take a look at a combination prompt. Combination prompts, like the example listed here, have quickly emerged as a crowd favorite. This question is a combo prompt that requires the LLM to assess two data sources to answer this question. Number one, the structured clinical data, in this case, allergy details sourced from EHR records, and two, unstructured knowledge management. So this is your documented policies and procedures sourced from internal documents like your PDFs and Word documents. There are also some critical safety protocols built into the model to ensure privacy, safety, and accuracy. Let's take a look at some of the results from our demo instance recommending proper procedures, precautions, and measures for a patient or resident with specific allergies. So in this case, let's list all the allergic reactions reported for the resident or patient named Andrew Salas. Let's create a care plan for Andrew based on these allergies. So now we're adding a combination prompt by asking to connect clinical structured data with unstructured data, which is knowledge management. These are our internal documents, processes, and procedures. So right now it's creating a care plan specifically for Andrew based on the reported allergies. So it's taking the information sourced from EHR records and combining it with our internal policies and procedures to create a custom care plan for Andrew. Now it's important to note to always work closely with medical professionals when administering these types of plans. Remember, generative AI is designed to be your co-pilot, not fly the plane. Human oversight must always take precedence. These tools are your personal assistants to unlocking human potential and productivity to provide better care outcomes. These are just a few of the many examples of how structured data, clinical population health, can be used with generative AI in the Skypoint platform. Head over to our website and schedule a demo for more examples.